Yagiana toke, Ibo Quay, you know, I do our own. And I'm so my brother, sister, but the Kada, I do our own. She don't you know, me photo run on to your tea, correct when but the Kada, I do our own. I would do now, but do when you would want to concern. In the game, the Kada, I do our own. A young Indiana, I'm telling you, every day is not the same. Today, not today, no time to play. Nakadam bok, no delay. You want to numb for the day. I thank the Lord for giving me a
Avoid rising.
The year 2020 came in with lots of promises, with varying projections and expectations from different persons across communities all over Nigeria. But no one knew such projections and plans would be severely affected by the outbreak of a novel virus that was first detected almost innocuously in the Chinese city of Wuhan. This virus, which the World Health Organization (WHO) would later codename COVID-19, would later affect every known models and norms of engagements across the world. Predictably, the situation elicited concerns from the public and governments, and although Nigeria recorded the first index case on February 27, 2020, it was not until the late night on April 1, 2020, that the Nigeria Center for Disease Control (NCDC) announced that 5 persons, mostly health workers, had tested positive. As a proactive and pragmatic leader, Governor Emmanuel swiftly made a broadcast to reassure the people that the government of Akwa Ibom State was ready and prepared to deal with the pandemic decisively, given the government's robust plans for the healthcare sector as outlined in the completion agenda.
We watch on the news that 5 cases have been confirmed positive by the NCDC. Thankfully, this information, sad as it is, did not meet us unprepared. I inspected facilities at one of the isolation centers we have prepared for possible cases such as now. This is in addition to the already existing one in Ikorekbene, and I can assure you that other facilities are being prepared for similar use should the need for it arise.
Prior to the pandemic, Governor Emmanuel, as if foreseeing the advent of the pandemic, had visited one of the isolation centers set up at the State Quaternary Health Facility, the Ibom Specialist Hospital.
It's not just to check the state of preparedness that we came to do. It's to make sure what we put on ground work and they are working well. So if you call that preparedness, well, I don't know what medical scientists will call it. You know, at times what people assume that those things are present and they are working well until they are put to test. You don't know whether they are working well or not. So I came here with the experts so that we can have a look to see that those things work well.
As a governor who knows that healthy citizens are the greatest assets any state can have, he announced strategic programs to prevent community spread of the disease and prepared to feed the people at home while he led the battle frontally. A leadership that accounted for the state's #1 position in contact tracing and treatment of affected persons by the NCDC.
To enable this process to be carried out effectively, I am hereby announcing a complete cessation of movement in the state, extended to a period of 14 days. There will be no movement of persons except those on essential duties who must carry a proper means of identification on them at all times. All business premises, markets, shops, motor parks, and offices must remain closed during this period. The only exception will be pharmacies and grocery shops. All events of any nature are prohibited during this period.
The foresightedness of Governor Udom Emmanuel during the lockdown occasioned by the COVID-19 pandemic also manifested in the palliatives distributed then to the people of the state, as all the food items, including flour, garri, rice, among others, were all locally sourced, produced from the rice mills, garri processing mills, and flour mills, all functional within the state.
Plans are underway for the provision of relief materials, including rice, garri, flour, and other essential food items to cushion and ameliorate the effects of the quarantine and restriction of movement regulation 2020.
His Excellency, our Governor Udom Emmanuel, is really worthy of commendation for what he has done. He is indeed a shepherd, a true leader with a listening ear. He sees and knows what is happening to his people, particularly in times like this. So many people are hungry because people are staying at home. People are not going to their markets, their farms, and anything. He is a gift from God to us.
I want to thank my governor for sending this palliative